Hello everyone, welcome to my YouTube channel Physiology Learning. In today's discussion, we are going to discuss about some of the clinical aspects of pain. Pain as such is a very vast topic, but we are not going to discuss about all the clinical aspects. We are going to pick some physiologically important clinical aspects and discuss them in this video. So let's get into the topic. We are discussing the CNS lectures, among which the sensory system is being discussed, out of which the nociceptors and pain, under which the clinical aspects of pain will be discussed under this video. So coming to the learning objectives, we are going to discuss a few terms here like hyperalgesia, allodynia, herpes zoster, like what is the kind of pain in herpes zoster, then tic doulourex, then phantom limb pain and Brown-Sequard syndrome. This Brown-Sequard syndrome will be discussed in a separate video after the tracts ascending as well as descending tracts is completed. This hyperalgesia and allodynia we have discussed in short in the referred pain video itself. We will just revise them through it and we will be discussing the rest of the three in this video. So coming to hyperalgesia, what is hyperalgesia? Hyper, as the term indicates, it means an increased response to a noxious stimuli. The point to note here is the stimuli here is noxious, but the patient is having an exaggerated response like in comparison to the other subjects. So the reason for this is there is an excessive sensitivity of the pain receptors. The sensitivity has been increased. Now coming to the second term, that is allodynia. What is allodynia? Here the patient is having a painful feeling for a non-noxious stimuli. The original stimuli itself is not painful, but he is saying he is having a pain. The classical example is the painful stimulus of a warm shower following a sunburn. After a sunburn, even a warm hot shower will cause the pain in all of us. So coming to the next term, that is herpes zoster. What happens? All of us know herpes zoster is a viral infection. What happens here is the virus usually infects the person. Not only that, what it is going to do is it is going to go and subside in the dorsal root ganglia. It will be staying there throughout the life of the person, and what it can do is this herpes zoster on a later stage can get activated and they can cause a pain in the particular dermatomal region. This herpes zoster usually they infect one half of the spinal cord, that is dorsal root ganglion of one particular region, it will go and settle in. So the presentation is also on a single side most of the times because the dermatome is innervated by the particular group of dorsal root ganglia. So what happens here is the infection causes a very severe pain in that dermatomal region which is subserved by that particular ganglia. That area will have a severe skin eruptions followed by severe pain. So coming to the next topic, that is tic doulourex, or it is also called as trigeminal neuralgia or glossopharyngeal neuralgia. The innervation of these two neurons are defective and even a simple stimulus like touch or food in the mouth can cause a severe kind of pain, and it will be a very specific kind of pain and it is called as lancinating or stabbing kind of pain. This happens because of the defective innervation which is creating a severe pain in these patients. So coming to the other pain, that is phantom limb pain. We have discussed in a detailed video in our explanatory series, but we will just revise through them. Here what happens is in phantom limb pain, whenever the patient leg is amputated, even after the amputation, the patient feels as if the patient is having the limb and he is having some painful stimulus in the limb which is amputated. So how does it happen? The reason for this is there is some reorganization of the thalamic region. What the thalamic region is doing is previously whatever stimulus is coming from that particular region, the limb is not there now, but the closed area which is also called stump. For example, after the amputation is done, they will put a stump like this. Now what happens is any stimulus to this stump region, the patient is thinking as if his limb is there and he is feeling the pain in the limb. The another reason for this is there is a remapping of the somatosensory cortex. The cortex which was responding for that particular limb, now it is remapped, and maybe it is remapped to other regions like the face also. So whenever the patient is touched in his face, he might feel as if he is having a pain in his limb which is amputated. I hope it's clear. Thank you for listening. We'll see you in the next video. Thank you so much.